Hello everyone, a warm greeting and welcome from my side. Myself Kirtana, studying in Osh International Medical University, belonging to Group 2A of second year. And today I'm going to explain about pharmacological characteristics of a drug called alprazolam. And in this presentation, I'm submitting to my teacher, Dr. Faisal sir. And today we're going to start about this presentation by talking about its general characteristics. Alprazolam. Yes, alprazolam is used to treat anxiety disorders and panic disorder, that is of sudden, unexpected attacks of extreme fear. And class of this alprazolam is they are mainly belonging to the class of drugs called anti-anxiety and anxiolysis or benzodiazepines, and they are commonly used or they are commonly sold in the brand names of Niravam and Xanax. Next, we're going to talk about this mechanism of action. Mechanism of action. They mainly are metabolized, like as we can say, they are bind with the receptors at several sites with the CNS, including the limbic system. As we are talking about this, this is the drug of like that is dealing with the anxiety and depression. They mainly bind with the CNS, including the like we can say about they are just binding their receptors. Actually, their target is to just bind with the receptors of the central nervous system and work among them. So they will just majorly bind at the several sites within the CNS, including the limbic system and reticular formation. As we know, limbic system regulates the major emotions of the body. So limbic system and reticular formation effects may be medicated through that GABA receptors.
Welcome to today's topic. Today's topic is lignocaine. Lignocaine is also known as lidocaine, a local anesthetic used as topical and injective form. Similar drug or equivalent drug is mipovacaine. This lignocaine is the widely used local anesthetic. Lignocaine is the fast and long-acting local anesthetic. It is useful for all type of blocks. Maximum anesthetic effect is seen in 2 to 5 minutes and lasts for 30 to 45 minutes. Action prevents the propagation of nerve action potential. Blocks small diameter pain fibers at lower concentration than large fibers. Vasodilation occurs in the injected area. Mechanism of action. Use dependent block of voltage gated sodium plus channels from inside of cell membrane. Penetrate cell membrane in its lipid soluble uncharged form. Less active in inflamed tissue where the lower pH increases ionization of the weakly basic local anesthetic. Abstraction, distribution or elimination. Topical application or injection. Topical application in forms of gel, solution, ointment, patches, etc. Penetrates membranes readily. Lidocaine, like other amide local anesthetic, is metabolized mainly in the liver by P450 system. Clinical use. Surface and infiltration anesthesia, nerve block, example dentistry, and epidural and spinal anesthesia. Adrenaline may be added to reduce loss to bloodstream. EMLA is a widely used topical combination of lidocaine with pyrilocaine. Used in ventricular dysrhythmia in MI, that is myocardial infarction. Adverse effect. In contrast to other local anesthesia, may be added to reduce loss to bloodstream. EMLA is a widely used topical combination of lidocaine with pyrilocaine. Used in ventricular dysrhythmia in MI, that is myocardial infarction. Adverse effect. In contrast to other local anesthetic, lignocaine causes drowsiness and mental clouding. Though it is a good corneal anesthetic, lignocaine is not generally preferred because it causes irritation. Toxicity of overdose causes muscle stretching, convulsion, cardiac arrhythmia, fall in blood pressure, coma, and respiratory arrest. Preparation available as 4% topical solution, 2% jelly, 5% ointment, 1 and 2% injection, 5% for spinal anesthesia, and 10% spray. Ways lignocaine reduces the transmission of pain to the CNS. It may be used as surface anesthesia, infiltration anesthesia, and nerve block. It is also used as epidural anesthesia and spinal anesthesia. Thank you.
Hello everyone, this is Satyashri from Group 2A International Medical University. Now I am going to explain about Parkinson's disease and its treatment. Outline, now we are going to see about reminder about Parkinson's disease. Parkinson's disease in the inpatient, surgical patients with Parkinson's disease, patients who cannot swallow, end of life care. Parkinson's disease. Parkinson's disease is the second most common neurodegenerative condition after Alzheimer's disease. Lewy body inclusions accumulate in brainstem, substantia nigra, and cortex. Prevalence 160 per 10,100,000 in UK. Incidence 13 per 10,100,000 per year but rises with age. 2% of those over 80, 10% of people in nursing homes. Diagnosis of Parkinson's disease. Throughout history, descriptions of the shaky palsy. James Parkinson first described cardinal features in 1817. Tremor, bradykinesia, stiffness, postural instability. Now we are going to see about diagnosis. Remains essentially clinical. Patient present in a heterogeneous manner. Tremor, gait problems, falls, stiffness or slowness. Non-motor manifestations of Parkinson's disease. Depression up to 60%, dementia up to 75%, sleep disorders, gastrointestinal disturbance, restless legs, pain, postural hypotension, urinary problems. Drug therapies for Parkinson's disease. Standard drug therapies, which includes levodopa, madoper or cinnamate, dopamine agonist, ropinirole, pramipexole, and rotigotin, MAOB inhibitors, that is selagiline, rasagiline, amantadine, COMT inhibitors, entacapone, tolsapone, stalevo. Drug therapies for later stage Parkinson's disease. Apomorphine, short-acting dopamine against, given as rescue for sudden off periods or as continuous infusion. Intragenual dopamine, duodopa, dopamine gel delivered by PEG tube. Parkinson's in the inpatient. Why do patients with Parkinson's disease come into hospital? Elevative admissions for surgery, emergency admissions relating to Parkinson's disease, relating to comorbidities, failure of social care, elective admissions for surgery. General advice for Parkinson's disease. Check what drug that they take and prescribe them at the correct time. Never ever give metoclopramide or prochlorperazine, stemetil, doperidone and cyclizine. Never give any antipsychotics except quetiapine. Parkinson's disease related admissions. Falls occur frequently in Parkinson's disease, can be caused by many factors. Under treatment.
Hello guys, this is Harish from 2A. Now we discuss about paracetamol in this video. Okay, let's see what it's happened in our daily uses, or why should we take the paracetamols as well as, okay, we can see in this video. First, paracetamol. Paracetamol generic name is paracetamol or acetaminophen. It is the trade name. In the another term, we use it in many shops as in trade names: Crocin, Metacin, Dianine, etc. Some brands are there. It belongs to the drug class. What are the drug classes? It belongs to the drug classes anesthetic and antipyretic drugs. It belongs to in this drug class only coming. And then let's see the mechanisms of actions. In this paracetamol has central anesthetic effect that is mediated through activation of descending serotonin pathways. In this mechanism of actions, this is the paracetamol. Okay, let's see the therapeutic uses. Paracetamol is commonly used medicine that can help treat pains and reduce a high temperature fever. In that time we commonly used for fever only. Uh, when we have the fever, our body temperature is so high, it will be in this medicine we take the use of reduce the it typically used to realize the mild and moderate pain. What are the moderate pains? What are the moderate pains? In such a headaches, toothaches, and sprains, and reduced fevers. And also it's used for illness such as cold and flu. Nowadays in that corona, in last 2 years, we affected in corona. That also maximum usage of paracetamol is high. It also corona also gives at a high body temperature, so it paracetamol only used to reduce the temperatures. And then see about that dosages. In adults we take the two 1 or 2 tablets. In 15 to 10 to 15 ages, children are taking 1 tablets. And then its dosage also have that 4 to 6 hours, leave at 4 hours between dosages. In 24 hours we taking the 4 hours per tablet. Okay. And then we can say about the side effects of paracetamol. um, in the side effects of paracetamol are rare. Paracetamols, okay, includes an allergic reaction which can cause a rash and swelling, flushing, low blood pressure, and a fast heartbeat. And this is about, in this video we can see about the paracetamol.
Hello guys, greeting. I am glad to introduce myself. I am Abdul Basit from 2A group, OSHIMU. Today topics we are see diclofenac. Scientific name is diclofenac sodium and its chemical formula is C14H10 Cl2 NO2 Na, and its average molecular weight is 318.1 AMU, and drug category is non-steroidal anti-inflammatory agents, NSAID. Non-steroidal anti-inflammatory drug, and it treats pain and inflammatory diseases. Next we see about mechanism of action. It inhibits prostaglandin by inhibiting cyclooxygenase 1 and cyclooxygenase 2 with relative equipotency. Next we see about uses. It uses treat ache and pain and problems with joints, muscles and bones. Example: rheumatoid arthritis, osteoarthritis. Next we see about dosage. Adult and children, 25 milligram 4 times a day. Children below 12 years, dosage based on level of pain. Next we see about side effects of diclofenac: feeling sick, diarrhea, headache, mild rashes. Next we see about interaction. Aspirin, when taken with diclofenac, aspirin efficiency is reduced. Antithrombotics, example: warfarin, clopidogrel, anticoagulants and antiplatelets. It increases the risk of serious bleeding. Next one is lithobyte. When taken with diclofenac, it reduces lithobytes absorption in human body, thus forming lithium toxicity. Thank you guys.
Hello everyone. Today topic is methotrexate. Methotrexate is one of the oldest and highly effective anti-neoplastic drug. an immunosuppressive disease modifying anti-rheumatoid drug and anti-metabolite anti-cancer drug. Action: as anti-rheumatoid drug has marked anti-inflammatory action in rheumatoid disease. As anti-cancer drug interferes with purine synthesis and the synthesis of thymidylate and thus with DNA synthesis. Mechanism of action: is a folate antagonist and thus interfere with thymidylate synthesis. Competitively inhibits dihydrofluorate reductase DHFR. As you can clearly saw the flow chart there, it is the mechanism of action: purine synthesis and pyridine synthesis. Pharmacokinetics: for rheumatoid disease given orally, for cancer given orally, and we can give by intraveinally or intramuscularly or intrathecally, taken up into cells by the folate transport system. It should be given in 30 mg and its lifespan is only to 6 to 9 hours. There you can see the tablet. Clinical use: drug of first choice for rheumatoid arthritis, MTX as an anti-cancer agent. Adverse effect: gastrointestinal disturbances, dose-related liver toxicity, myelosuppression, contraindicated in pregnancy. Methotrexate toxicity: folinic acid rescues can reduce methotrexate toxicity. Folinic acid is an active coenzyme form. Thank you.
Greetings guys, my name is Sri Shiva Shakti, 2A group, and I am from Osh International Medical University. The topic is penicillin. I am going to explain penicillin. Penicillin is a medication used to manage and treat a wide range of infections. It is beta-lactam antibiotic class of drugs, and this activity describes penicillin indications, actions, and contraindications and the valuable agents in treating infections. The mechanism and action of penicillin: the penicillin kills bacteria through binding and beta-lactam ring to DT transpeptidase, inhibiting its cross-linking activity and preventing new cells wall formations. It forms the cell wall formations, and without a cell wall, a bacteria cell wall vulnerable to outside and molecular pressures, which causes cell to quickly die. Side effects of the penicillin is nausea, vomiting, diarrhea, rashes, abdominal pains, and urticaria. And the uses of the penicillin is mainly skin infections and dental infections, ear infections, and infection of nose, throat, or lungs, urinary tract infection, other bacterial infection. These and all we use penicillin as give best results. And classifications of penicillin: penicillin is a medication used to manage and treat a wide range of infection, as we know. It is a beta-lactam antibiotic class of drugs. Thank you guys.
Good morning everyone. My name is Amisha. I'm the student of Osh International Medical University. I'm in second year, 2A group. Today I took medicine called glycopeptides. It's an antibiotic. So let's get started. Glycopeptide antibiotic. Glycopeptides are glycosylates, non-ribosomal peptides produced by a diverse group of soil acetomycetes. Target gram-positive bacteria by binding to the SLD NLD align terminus of growing peptidoglycan on the outer surface of the cytoplasmic membrane. Class of drugs. One of a class of antibiotics originally isolated from plants and soil bacteria with structures containing either a glycosylates, cyclic or polycyclic non-ribosomal peptides. Glycopeptide antibiotics are semi-synthetic macromolecules that are structurally related to the vancomycin and having antibacterial activities against several gram-positive organisms, include methicillin-resistant Staphylococcus aureus (MRSA). What is the glycopeptide family of antibiotics? The glycopeptide antibiotics are a group of glycosylates, cyclic or polycyclic non-ribosomal peptide that inhibit gram-positive bacterial cell wall synthesis. First generation glycopeptide antibiotics include vancomycin, teicoplanin, and ramiprofenil. Second generation semi-synthetic glycopeptide antibiotics include orictavacin, dalbavacin, and telavacin. Mechanism of action. Glycopeptide antimicrobial are a group of natural products and synthesis. Glycosylates peptides that shows antibacterial activity against gram-positive organs through inhibit of cell wall synthesis. Glycopeptides inhibit synthesis of cell wall peptoglycan and inhibit bacterial cell membrane permeability. They also affect bacterial RNA synthesis. Vancomycin has limited use in veterinary medicine because of high cost and the need of continuous for infusion. Clinical uses. Antibiotics are used to treat or prevent some types of bacterial infections. They kill bacteria or prevent them from reproducing and spreading. Antibiotics aren't effective against viral infections. This includes the common cold, flu, most coughs, and sore throats. Side effects. The recommended dose in adult is a single infusion of 1200 mg intravascular over a 3-hour period. Side effects include infusion reactions, headache, nausea, diarrhea, skin rashes, and pruritus. Rare side effects include hypersensitive reactions sorry, and Clostridium difficile colitis, and abdominal pain, back pain, diarrhea, edema, foamy urine, headache. What are the sources of glycopeptides? Glycopeptides are glycosylates, non-ribosomal peptides produced by a diverse group of acetomycetes that target gram-positive bacteria by binding to the acetyl-D-alanine terminus of the group, growing peptidoglycan on the outer surface of cytoplasmic membrane. What type of antibiotics is glycopeptide? First generation glycopeptide antibiotic include vancomycin, teicoplanin, and ramiprofenil. Second generation semi-synthesis glycopeptide antibiotics include orithravacin, dalbavacin, and telavacin. Glycopeptides are an important class of antibiotic active against gram-positive pathogens, but vancomycin and teicoplanin are the only two glycopeptide antibiotics currently used in clinicals. Thanks for your attention. Thank you so much.
Name of the drug is ceftriaxone. This ceftriaxone comes from the category third generation cephalosporin. Brand name and manufacturer of this drug is Afromax, Monosef, Monotax, and Rosfin. Available formulation with the strength of this drug. Injectable is 0.25, 0.5, 1 gram per vials. For infusion, 1 gram, 2 gram. For powders, 250 milligram, 500 milligram, 1 gram, 2 gram, and 10 gram. And here the indications of the drug. There are bacteremia, septicemia, serious respiratory tract infection, gonococcal meningitis, bone, joint urinary tract, gynecologic, intra-abdominal, skin. And these infections are caused by susceptible organs. Now we see about mechanism of action of this drug. Third generation cephalosporin with broad spectrum gram negative activity has lower efficacy against gram positive organism but higher efficacy against resistant organism. Is highly stable in presence of B lactomases, penicillinase and cephalosporinase of gram negative and gram positive bacteria. And then bactericidal activity results from inhibiting cell wall synthesis by binding to one or more penicillin binding proteins, exerts antimicrobial effect by interfering with the synthesis of peptidoglycan, major structural component of bacterial cell wall. And here pharmacokinetic parameters in absorption there is well observed administered IV and IM. For distribution, distributed widely into most body tissue and fluids including the gallbladder, liver, kidney, bone, sputum, bile, pleural and synovial fluids. Unlike most other cephalosporins, ceftriaxone has got good CSF presentation. It cross placental barrier. Protein binding is dose development and decreases serum level rise. Average is 84% to 96. After that, metabolism is partially metabolized in liver. Excretion, excreted principally in urine. Some drugs is excreted in bile by biliary mechanism and small amount appear in breast milk. Severe renal diseases prolongs half-life only moderately. Neither hemodialysis nor peritoneal dialysis will remove ceftriaxone. And we see half-life of this drug is 500 to 11 hours in adults with normal renal function. In time action profile, we have onset and onset IV represent immediate. We have peak. In peak, IV represent also immediate. In peak, IM represent 1.5 hour to 4 hour. And now we have pharmacodynamic parameters. Dose. Adult and children aged 12 and older, 1 or 2 gram IM or IV once daily are in equally divided doses. Children younger than age 12, totally daily dose is 50 to 75 mg kg IM IV is given, divided doses, question 12 hours. Maximum daily dose is 2 gram. In ADRS represent American depository recepts. Here GI pseudomembranous colitis, diarrhea, hematologic, eosinophilia, thrombocytosis, leukopenia. And skin, pain, induration and tenderness at injection site, rashes. And other hypersensitivity reacts, example serum, sickness, anaphylaxis. Drug interaction. Aminoglycosides produces synergistic antimicrobial activity against Pseudomonas aeruginosa on some strains of Enterobacteriaceae. Monitor patient closely. Probenecid may increase clearance by blocking biliary secretion and displacement of ceftriaxone from plasma proteins. Avoid use together. And quinolones produce in vitro synergism against Streptococcus pneumonia. Clinical level is unknown. And we have contra.
Good afternoon everyone, I am Darshana from 2A group. Today we are going to discuss about a drug, levodopa. First we are going to tell about the class of the drug. Levodopa is a class of medication called dopamine antagonistic. Levodopa works by mimicking the action of a dopamine, a natural substance in the brain that is lacking in patients with Parkinson's disease. Next, the action of that drug levodopa by various routes crosses the blood-brain barrier, is decarboxylated to form dopamine. This supplemental dopamine performs the role that endogenously dopamine cannot be used to decrease of natural concentration and stimulate dopaminergic receptors. Next, the therapeutic uses. Levodopa is the precursor to dopamine. Most commonly clinical use of levodopa as a dopamine replacement agent for the treatment of Parkinson's disease. It is most effectively used to control bradykinetic symptoms apparent in Parkinson's disease. Next, side effects. The common adverse effect of levodopa treatment are nausea, dizziness, headache. Increased carbidopa is recommended to relieve nausea, and domperidone can be helpful if additional carbidopa is ineffective. Next, adverse effects. Nausea, hallucination, postural hypotension with progressive disease. Levodopa can lead to off-on phenomenon with improved mobility during on
periods, then impaired mobility, motor function during off periods when patients respond poorly to levodopa or medication wear off. Next, contraindications. The use of levodopa is contraindicated with the concurrent use of monoamine oxidase inhibitor because it can lead to a hypertensive crisis. This should be a 14 days washout periods when switching from levodopa to an monoamine oxidase inhibitor or vice versa. Next, drug to drug interaction. Some products that may interact with this drug include antipsychotic drugs, certain drugs used to treat high blood pressure, such as methyl dopa. Taking monoamino oxidase inhibitor with this medication may cause a seriously drug interaction. Thank you for your attention.
Hi guys, I am Wasim Raja from 2A group. Today we see about pantoprazole. Introduction. The proton pump inhibits a group of drugs whose main action is pronounced as long-lasting reduction of gastric acid production. Yeah, omeprazole, lansoprazole, and dexlansoprazole, esomeprazole, pantoprazole, and rabeprazole and elaprazole. And this is pantoprazole is substituted benzimidazole and proton pump inhibitor drug that inhibits gastric acid secretion. It is used to treat gastroesophageal reflux disease, a condition that causes a gastric juices to flow upward from your stomach and into the esophagus. It also treats condition of in which the stomach makes excess acid, such as Zollinger-Ellison syndrome. It works to shut off the acid pumping cells in your stomach. It reduces the amount of stomach acid and helps to reduce painful symptoms related to the gastroesophageal reflux disease. And mechanism of action. Pantoprazole is a proton pump inhibitor that suppresses the final step in gastric acid production by conveniently binding to the ATPase enzyme system that is the secretory surface of the gastric parietal cell. This effect leads to inhibition of both basal and stimulated gastric secretion. And irrespective of the stimulus, that binding of pantoprazole ATP is irreversible in nature and effectively inhibit acid secretion until new enzyme is synthesized. And pharmacokinetics rapidly observed after oral administration, and the set of action is within 2 to 4 hours. Duration of action is about 24 hours. Peak concentration and the time of reach to peak concentration is 2.5. The drug is subjected low fast hepatic excretion. The oral bioavailability is 77%. Approximately 71% of dose was excreted in the urine. Within 80% of excretion in the feces through biliary secretion. There was no renal excretion, unchanged pantoprazole. Only site to moderate the increases in pantoprazole, AUC 43% and Cmax 26% were found in the elderly volunteers, 64 to 76 years of age after repeated oral administration. Compared with the younger subjects, no dosage adjustment is recommended based on age. Dose adjustments. Gender. There is a modest increases in pantoprazole, AUC and Cmax in women compared to the men. However, weight is normalized, clearance values are similar in women and men. No dosage adjustment in recommended based on gender. Renal impairment. In patients severe renal impairment, pharmacokinetic parameters for pantoprazole were similarly those to healthy subjects. No dosage adjustment is necessary in patients with the renal impairment or patients undergoing hemodialysis. Indications: to treat ulcers in the stomach and the part of gut in the duodenum, to reduce acid reflux which may cause heartburn or inflammation in the gullet. This condition of sometimes called gastroesophageal reflux disease as one part of treatment to get rid of Helicobacter pylori, a germ found in the stomach, which can cause ulcers. To help prevent and treat ulcers associated with the anti-inflammatory medicines called non-steroidal anti-inflammatory drugs. In rare condition, Zollinger and Ellison syndrome called Zollinger and Ellison syndrome. In other condition where it is helpful to reduce acid in the stomach. Not to prescribe or take pregnancy. Pregnancy category B. This drug should be used during pregnancy only if clearly needed. Nursing mothers, pantoprazole excretion in human milk has detected in a study of single nursing mother after a single 40 gram mg oral dose. The clinical relevance of this finding is known. Many drugs which are excreted in human milk have a potential for serious adverse reaction in nursing infants. In long-term studies, pantoprazole was carcinogenic and it caused rare types of gastrointestinal tumors. The relevance of these findings to tumor development in humans is unknown. Bone fracture. Several published observation studies suggest the proton pump inhibitor therapy may be associated with an increased risk of osteoporosis related fracture of hip, wrist, and spine. Possible side effects: common gastrointestinal, abdominal pain, and diarrhea, and nausea, and vomiting, and neurologic headache and dizziness. Gastrointestinal constipation, dry mouth, and hepatitis. Blood problems, white blood cell count, and thrombocytopenia. Immunologic Stevens-Johnson syndrome, toxic epidermal necrosis, and metabolic, elevated creatine kinase, elevated cholesterol levels, and elevated liver enzymes and swelling. Musculoskeletal muscle disorder and bone fracture and infection, and Clostridium difficile infection, osteoporosis, related hip fracture, and rhabdomyolysis. Long term, osteoporosis and bone fracture have been observed in patients on high dose or long term prescription proton pump inhibitors. Hypoglycemia has been observed in patients on medication like pantoprazole when taken for longer period of time, generally 1 year or more. Although causes can be reported with the regimens as short as 3 months. Thank you.
Hello, my name is G. Veeramani from 2A group. Today topic is ibuprofen. Introduction: Ibuprofen is a traditional non-steroidal, anti-inflammatory drug that is not NSAID, widely used in treatment of mild to moderate pain and inflammation. The formula is C13H18O2. That half time is 1.822 hours. Ibuprofen inhibits the cyclooxygenase enzymes COX-1 and COX-2 coded for by PTGS1 and S2, preventing the formation of various prostaglandins. There is a procedure like this: mechanical shock or temperature that is leads to a cell membrane damage, releases arachidonic acid, AA omega-6 we can call, it is a phospholipid, is converted by COX-1 or COX-2 to inhibit ibuprofen. To give COX-1 to give kidney and liver function and platelet activation prostaglandins, and COX-2 to give inflammation and pain mediating prostaglandins. Ibuprofen has a wide therapeutic concentration range for its analgesic, antipyretic, and anti-inflammatory effects. The inhibition of COX-1 inhibits the production of prostaglandins and thromboxans. This in turn leads to the following three major effects: anti-inflammatory drug, analgesic drug. Anti-inflammatory is modification of inflammatory reaction via decrease in vasodilator prostaglandins, and this is reduction of certain sorts of pain via reduced sensitivity of nerves to certain inflammatory mediators. Uses: relieve minor pain and inflammations including headache, muscular aches, toothache, fever, and backache. It is used for long-term treatment of rheumatoid arthritis, spondylitis, and other chronic conditions. Absorption: therefore absorption. First is absorption. The absorption of ibuprofen is rapid and complete when it's given orally. Prescribed doses of ibuprofen adult 200 to 800 milligram every 6 to 8 hours, and pediatrics 5 to 10 milligram per kg every 6 to 8 hours. And intravenous formulation is also approved for use in USA. And distribution, this is second round after absorption. Ibuprofen binds extensively in a concentration dependent manner to plasma albumin 200 to 400 mg, and at doses greater than 600 mg there is an increase in unbound fraction of drug leading to an increased clearance of ibuprofen. The third one is metabolism. Metabolism occurs mainly in liver and sometimes in gut also. Ibuprofen is also completely metabolized with little to non-unchanged drug found in urine. The fourth is excretion. Urine excretion of the two major metabolites, carboxylic ibuprofen and 2-hydroxy-ibuprofen, and the corresponding acyl glucose. CYP2C9 is the primary CYP isoform responsible for ibuprofen clearance. The transport, various classes of transporters interact with ibuprofen: organic anion transporters in the kidney and GI tract, hepatic organic anion transporters, and multi-drug resistant protein family of transporters, and the intestinal peptide transporters. Pharmacodynamics. The main mechanism of action of ibuprofen is the non-selective reversible inhibition of cyclooxygenase enzymes COX-1, COX-2, and catalyzes the first committed step in the synthesis of prostaglandin, also known as the prostaglandin, and thrombosin. Prostaglandins are found in inflammatory exudates and can reproduce the cardinal signs of inflammation, including pain and fever. They are generated from arachidonate by the action of cyclooxygenase COX isoenzymes. Advantages: a wide therapeutic window and the lack of prolonged retention in the specific body compartments make ibuprofen a selectively safe drug. Have greater antibiotic and analgesic effects in both children and adults compared with commonly used doses of aspirin. Adult 500 to 1000 mg every 6 to 8 hours, in pediatric 10 to 15 mg. Thank you guys.